if you want to fist bump me. I'm Dr. Deuk, and we're here with one of my patients who just had Deuk laser disc repair a week ago.
Yep.
And you look good. You're beaming.
Thank you.
How you feeling?
Wonderful. Feel wonderful. No pain.
No pain.
No pain.
Wonderful.
So far, no pain.
I'm not surprised. I may look surprised, but I'm not surprised. So the Deuk laser disc repair is a surgery she had. It's an endoscopic surgery done with a 7mm incision. And this is for your lower back. And you're a work comp patient, right?
Yes, I am.
So for those of you who don't think work comp patients get better with surgery,
You do.
it's absolutely not true. As long as the surgery is done right and the right kind of surgery is done, they do fantastic. They're just like everyone else. They don't all have hidden agendas. So
Went back
she's
to work 2 days later.
back to work 2 days after surgery. There's no other surgery in the world that will do that. So what did you have? Herniated disc, stenosis, pinched nerves, back pain, leg pain.
Yes, all of the above.
So typically these patients would have a big surgery like a fusion or artificial disc. That would lay them up for months and no work. But she had the Deuk laser disc repair, which is an advanced revolutionary laser repair of the discs. She had 2 discs repaired, and you went home. How long were you at the facility, surgery center?
About an hour and a half
Yeah,
afterwards.
An hour after surgery, and then she went home.
Mm-hmm.
And when did you start driving again?
The next day.
The next day she drove, right? Which is, we expect all this,
Yeah.
right? But I'm just letting the audience know because many of them have never seen a patient that had laser surgery at the Deuk spine.
It was very great. It was a wonderful experience all the way
Excellent,
through.
excellent. Now I see some flowers over there.
Yes.
Are those for Hope?
Yes. No, she gave them to me.
Oh, she gave it to you.
Yeah.
What a great, those are beautiful.
Aren't they
Can you show
beautiful?
them?
They're
I've never seen those
beautiful.
kind of colors before. That's
Yeah,
beautiful.
Beautiful. And she's been wonderful.
Yeah, Hope is amazing. We have a really good team.
The whole team is wonderful.
Yeah.
I appreciate everybody.
Now, do you have a back brace on?
Yes,
you do.
I
My
do.
gosh, I can't even tell. She's wearing a full-on TLSO back brace. And just look at her. I mean, it doesn't even look like you have a back brace on. Great job of hiding
Yes.
it.
I have to.
Tell us, since you know, the hot topic is 2018, and this country is now suddenly overnight in a painkiller or opioid crisis, which, by the way, I completely don't agree with. We've had an opioid crisis for the last 20 years. It's not just overnight. It's been ignored. So what kind of opiates or narcotics were you on after your back surgery, the laser surgery?
I have not been on anything.
Right.
Really. I've had one little pain pill, and that was it. I
Yeah.
haven't-
So this is incredible, right? So this is a patient with like 100 million people a year in the United States that have back pain, leg pain, fat discs, and we went in and repaired them with Deuk laser disc repair. She went home an hour after the surgery, and she took 1 pain pill. So there's no pain medication that she's taking, and that is why the surgery is so advanced and so amazing for so many reasons. Back to work quick, minimal pain, no narcotics, and high success rate, 100% relief of her pain.
No
So
Tylenol, no leave.
we're very happy for you. Congratulations. We want the
Thank
rest
you
of the world
so
to know
much.
about this amazing
Wonderful
surgery
experience.
to fix back and neck problems. Great to see you.
Wonderful.
Okay?
Thank
So,
you very much.
all right. Thank you. Any questions?